Mr. Doxy?
Hey, how are you?
Hi, I'm Ryan Johnson. I'll be your doctor today.
Good to meet you.
So I was looking over your chart and it sounds like you may have some blisters going on.
Yeah, I think my biggest problem is just this big one right here on the bottom
Yeah.
of my toe.
Yeah, I see it. How did you get that?
I was playing basketball with some teenagers for too long in bad shoes.
Bad shoes, huh?
Yeah.
Could you feel it coming on then
Yeah.
during the time? All right. So it only just started when, like 2 or 3 days?
Yeah, that was 2 days ago.
2 days ago now. Okay. So is it painful at all?
Yeah, it is.
And what kind of pain would you say? Does it shoot up your leg or is it pretty localized in this area?
It's just really right around there, and
Okay.
yeah,
Yeah, I don't see any other.
kind of sharp pain. Only when I stand on it.
Right, okay. And is there anything that aggravates it, makes it worse, or makes it better?
Just touching it,
Yeah.
anything like that. Making it better, leaving it alone.
Okay, that's fine. And like you said, this happened 2 days ago, so, but during the day, it's pretty much the exact same feeling you have.
Yeah.
All right, perfect. And pain-wise, it doesn't look so bad, but what would you give a 2?
Maybe 2 out of 10.
Just more kind of annoying, more than
Yeah.
anything.
Yeah.
Okay, perfect. So since you're new to our office, I just need to ask you a few questions, just for medical reasons, make sure that this isn't another underlying condition that we just aren't aware about.
Yeah.
So if that's okay with you, I'll just ask you a few questions, then we'll go on and look a little bit more, okay?
Yeah.
All right, have you ever been hospitalized or had any surgeries?
I had my meniscus repaired when I was a teenager.
When you're a teenager, okay, but everything's fine, no more scopes to clear out.
No.
Okay, perfect. Immunizations, are you up to date with shots?
Yep.
Okay, perfect. Illnesses, any real illnesses, severe illnesses you've had?
Not really.
Nothing, just the norm.
Yeah.
Okay, perfect. Medications, do you take any meds or even vitamins, supplements, anything like that?
No, I don't take anything.
Okay. Like a men's vitamin may be healthy for you because you're getting a little older now. So I may get on that bandwagon. Allergies. Do you have any seasonal allergies to medications? Nothing like that. Okay.
No.
Have you ever had any blood transfusions?
No.
Never. Okay. Not even for your knee. You were fine.
Yeah.
Perfect. An emotional state. You look like you're a pretty happy guy. So
Yeah.
good to know. All right. How's your sleeping going? You get enough sleep?
Yeah, I go to bed at like 10:30 every night and get up at 6.
Wow, that's a pretty good schedule.
Yeah.
I like that. Smoking. Do you smoke? Use tobacco? Have you ever used tobacco?
No.
Nothing? Okay, cool. Are you sexually active?
Yes.
Okay. Are you married?
Yes.
Perfect. So it's just a monogamous relationship? Cool. It's always good to stay away from trouble that way. Work. What do you do for work?
I'm a student
Student. Where do you go to school at?
at Barry,
And you're studying what?
podiatry.
Perfect. Well, maybe you can shadow later on.
Yeah.
Exercise-wise, do you get out and work out at all?
Not as much as I should. I mean, obviously I'm doing stuff like playing basketball, right? But no. Not
But
as much as
it looks like it's not a very common
That's
thing,
right,
right?
that's right.
Okay. Diet-wise, how's your diet? Pretty balanced?
Yeah, it's pretty good.
Okay. Do you drink alcohol at all?
No.
Any drug use now or previously?
No.
Okay. Pets. Do you have any pets at the house?
No.
Okay. And travel-wise, have you been outside the country recently?
No.
Okay. Perfect. Also, family history. Does your parents or either of your grandparents have a history of diabetes, cancer, high blood pressure, hypertension? High cholesterol, excuse me.
Yes. On both sides of my family, I have high cholesterol. My dad has hypertension,
Okay.
and my maternal grandmother died of lymphoma.
Okay. All right. But you're checking out fine right now, right?
Yep.
Keep going. Keep it up, because sometimes it comes to get you later on. Okay. Perfect. That's it for the questions. But what I'd like to do, if you could pull up your pant legs up to your knees, I'm gonna just give an assessment of both legs. So if you don't mind, I'm gonna just kind of touch and feel, make sure the temperature's fine. Pick up your legs. Is that all right?
Yep, that's
perfect. All right. Temperature-wise, they feel pretty good. They're about normal. I don't see any bruises or bumps besides, not on this leg, right? And this leg didn't look like you got any blisters. This leg here looks fine as well. Nothing under here. Just that one blister on your big toe, huh? Perfect. Now what I'm going to do is I'm going to pinch your skin a little bit. It won't hurt. But this is just to see the elasticity of it. Perfect. Perfect. Alrighty. Now I'm going to check in between your toes real quick, because sometimes you may get a blister here too. And this is also a place that a lot of people miss because so far down, especially men, they get inflexible later on in life, right? So you don't really go down there. And your nails look pretty good. This one looks like it may have a little bit of fungus, but have you ever treated that? Okay, maybe we'll bring that up later, okay? Now I'm gonna do an assessment of your blood vessels that are coming down here. First, I'm gonna check this right here. It's called your dorsalis pedis. Perfect, it's like a 2 out of 4, which is good. You want it to be in the midline. Now I'll check your posterior tibial. Good, both of those are very healthy, 2 out of 4. And then I'm gonna check behind your knee here. This is called your popliteal artery, okay? Perfect, 2 out of 4 on that one, and 2 out of 4 on that one. Awesome, now what I'm gonna do is just double check. There's this thing called a Doppler, and all it is it makes a loud noise to make sure that your blood vessels are working the way it should, okay? So let me grab this tool real quick, and we'll check it out. Perfect. Alright, behind here. Nice and healthy. Perfect. Now let me check this other side real quick. Nice. Check this one as well. There we go. Perfect. Yeah, you sound really, really healthy. All 2 out of 4, okay? I don't see any edema or anything like that swelling in your feet, which is good. I'm going to check the capillary refill time though on this, and that's just to check the blood filling of your toes. And you have a lot of hair growth on your toes and your feet, so it means you got good blood flow. Now we're going to check a couple other things like your reflexes right now. Let's check, this is called the Babinski reflex. I'm just going to move this across your foot. And you don't have any reflexes, which is really good. That means you don't have an upper motor neuron lesion. Now let me check your knee reflexes, your knee and your Achilles. So could you just scoot down here for me? Awesome. I'm sure you've done this before.
Yep.
Perfect. Let me check the back of your heel now. Okay. Let me check this leg. Perfect. And then the back here too. Perfect. That one won't give you a big jerk like the knee will, but your reflexes are pretty good. I would say they're a 2 out of 5, which is what you want. Okay. Now let me check this. If you could scoot back, I'm going to check a few other things. First, close your eyes for me.
Okay.
The next few tests, you'll just need to close your eyes and tell me when you feel the vibration, when it stops. Okay.
Okay. I can feel it. Stop.
Okay.
Yes. Stop. Yes. Stop. Yes. Stop.
Sometimes you start to anticipate those kinds of things. All right, now I'm gonna do a sharp dull test for you. Same thing. Close your eyes and you tell me this is dull, and then this will be sharp. Okay.
Okay.
All right. So you tell me what it feels like.
Soft.
Okay.
Sharp.
Okay.
Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp.
Perfect. All right. Now I'm gonna do another test. I'm just gonna check also if you could feel this as well. So close your eyes. I'm gonna touch your feet a couple places, and you tell me when you feel it. Okay.
Okay. Yes. 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 Yes.
Okay.
Yes. 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 Yes.
Perfect. All right. Now I want you to close your eyes as well. I'm gonna move your toe up and down, and I want you to tell me if you feel that or if it goes up or down. Okay.
Okay. Up. Down. Up. Down. 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 Up.
Perfect. Now what we're gonna do is I want to check to see how much flexibility you have real quick as well. So if you scoot back a little bit for me, this is a little bit easier that way. All right. I'm gonna check to see how your Achilles, your calf muscles are pretty much. Perfect. Okay. We'll try over here as well. Get your foot there. All right, I want to push up. Awesome. Yeah, I think you're okay right there with our test, our silver skygo test. Now, if you could just push against my hands, with your feet, that would be great. Perfect. Okay. Perfect. You got about a 5 out of 5 with your muscle strength there. So here's what I think we're gonna do. We have the blister, of course we know. it looks like you've kind of taken care of it somewhat. What we're gonna do is we're gonna bandage it and we're gonna pat it, okay? And that should take care of it. It doesn't look infected or anything. If it does seem to start to hurt, get a little bit more red, inflamed, we may need to give you some sort of antibiotic because that means there's probably got infected. But for now, we'll pat it. The other thing we can look into is your shoes and maybe your socks because we don't want this to happen again. But it sounds like you just had the wrong shoe gear on that day.
Yeah.
So let's do that and maybe follow up in a week to make sure things are cleared up. Do you have any questions about anything?
No, I don't think so.
Okay, perfect. Well, it was a pleasure meeting you. I'm going to have my nurse come in and help out with this, and away we go, okay?
All right, thank you.
All right, thank you, Mr. Doxey.